Hello, I am Dr. DeAndre. Today I will talk about face wash mistakes you must avoid. These mistakes are extremely common in daily skincare routines and are directly associated with disruption of the skin barrier, increased acne formation, chronic dryness, irritation, and in some cases, long-term premature aging of the skin. Many patients do not realize that even simple daily cleansing habits, when performed incorrectly, can lead to measurable dermatological damage over time. Clinical dermatology research consistently shows that the skin barrier is highly sensitive to environmental and chemical stress. When this barrier is disrupted, transepidermal water loss increases, microbial balance is affected, and inflammatory pathways are activated. These biological changes do not always produce immediate symptoms, but over weeks and months they manifest as persistent skin problems. Today, we will break down the most scientifically supported mistakes people make while washing their face. Each point is based on dermatological evidence and clinical observation, not cosmetic marketing claims. The goal is to help you understand how your daily habits may be contributing to skin problems without your awareness. Let us begin by understanding the skin barrier itself and why cleansing plays such a critical role in maintaining skin health. The skin barrier, medically known as the stratum corneum, is the outermost protective layer of the skin. It is composed of skin cells and lipids arranged in a structured matrix. Its primary function is to prevent excessive water loss and block entry of harmful microorganisms, allergens, and irritants. In dermatology, this barrier is considered essential for maintaining overall skin health and resilience. Scientific studies show that when the skin barrier is intact, the skin maintains proper hydration, balanced oil production, and a stable microbiome. However, when this barrier is damaged, multiple skin conditions can develop, including eczema, acne, rosacea-like sensitivity, and chronic dryness. One of the most overlooked causes of barrier damage is improper face washing. Cleansing is necessary to remove sweat, environmental pollutants, sebum, and cosmetic products. However, excessive or harsh cleansing disrupts the lipid structure of the barrier. This increases transepidermal water loss, meaning the skin loses moisture faster than it can retain it. Over time, this leads to dryness, irritation, and compensatory overproduction of oil, which paradoxically worsens acne in many individuals. Clinical dermatology data shows that patients with compromised skin barriers often report burning sensations, tightness, and increased sensitivity even to mild products. These symptoms are not always due to allergies, but due to structural damage of the skin barrier itself. Therefore, understanding how cleansing interacts with the skin barrier is fundamental. The goal of face washing is not to strip the skin completely, but to maintain balance. Any routine that removes too much natural oil or disrupts the lipid layer can initiate a cycle of damage and inflammation that becomes progressively harder to reverse without medical intervention. One of the most common skincare mistakes is overwashing the face. From a dermatological perspective, cleansing more than necessary does not improve skin health. Instead, it often leads to barrier disruption. The skin naturally produces sebum, which serves as a protective lubricant. When this layer is repeatedly removed through frequent washing, the skin responds by activating compensatory mechanisms. Clinical studies show that overwashing can increase transepidermal water loss and trigger sebaceous glands to produce more oil. This creates a cycle where the skin feels oily, prompting more washing, which further worsens the imbalance. This pattern is commonly observed in patients with both acne-prone and sensitive skin types. Dermatology guidelines generally recommend washing the face 1 to 2 times per day. Morning cleansing is optional depending on skin type, while evening cleansing is considered essential to remove accumulated pollutants, sunscreen, and sebum. Exceeding this frequency is rarely beneficial and often harmful. Overwashing also disrupts the skin microbiome. The skin hosts a diverse population of beneficial microorganisms that protect against pathogenic bacteria. Excessive cleansing reduces microbial diversity, making the skin more vulnerable to inflammation and infection. Patients often report symptoms such as tightness, flaking, redness, and increased sensitivity when they overcleanse. These symptoms are frequently misinterpreted as requiring stronger products, which further worsens the condition. In clinical practice, reducing cleansing frequency alone often improves skin hydration and reduces irritation within 1 to 2 weeks. This demonstrates that less intervention is often more beneficial when it comes to skin barrier health. The key principle is balance. The skin should be clean but not stripped. Maintaining this equilibrium is essential for long-term dermatological stability. The use of harsh cleansers is another major factor contributing to skin barrier damage. The skin naturally maintains a slightly acidic pH, typically between 4.5 and 5.5. This acidity is essential for enzymatic activity, lipid production, and microbial defense. When this pH balance is disrupted, multiple physiological processes become impaired. Many traditional soaps and strong foaming cleansers are alkaline in nature. When applied to the skin, they temporarily raise the pH level, disrupting the acid mantle. This leads to reduced enzyme activity responsible for lipid synthesis, weakening the barrier function. Ingredients such as sodium lauryl sulfate are known to be effective in removing oil, but can be overly aggressive for sensitive skin types. Clinical studies have shown that repeated exposure to such surfactants can increase skin dryness and irritation, especially in individuals with pre-existing skin sensitivity. pH disruption also affects the skin microbiome. Beneficial bacteria that thrive in acidic environments decrease, while opportunistic organisms may increase. This imbalance can contribute to inflammatory skin conditions, including acne and dermatitis-like presentations. Patients often experience symptoms such as burning sensations, redness, and excessive dryness after using harsh cleansers. These symptoms are not always immediate, but can develop gradually with continued use. Modern dermatological recommendations emphasize the use of gentle, pH-balanced cleansers. These products are designed to remove impurities without significantly altering the skin's natural acidity. This allows the skin barrier to remain functional while still maintaining hygiene. Maintaining proper pH is not a cosmetic concern. It is a biological requirement for healthy skin function. Any routine that consistently disrupts this balance can contribute to long-term barrier dysfunction and increased skin sensitivity. Water temperature is often overlooked in skincare routines, yet it plays a significant role in maintaining skin integrity. The skin is sensitive to thermal stress, and exposure to extreme temperatures can directly affect its barrier function. Hot water is particularly damaging because it dissolves natural lipids in the stratum corneum more rapidly than lukewarm water. These lipids are essential for maintaining moisture retention and structural stability. When they are stripped away, the skin becomes more permeable, leading to increased transepidermal water loss. Clinical dermatology observations show that patients who frequently wash their face with hot water often present with dryness, redness, and increased sensitivity. In some cases, hot water exposure can exacerbate conditions such as rosacea due to vascular dilation. Cold water, while less damaging, may not effectively remove oils, sunscreen, or environmental pollutants. Therefore, it is not considered optimal for cleansing purposes in most cases. The recommended temperature range for facial cleansing is lukewarm water. This temperature is sufficient to dissolve impurities while minimizing disruption to the lipid barrier. Thermal stress also affects blood vessels in the skin. Hot water causes vasodilation, which may result in temporary redness and inflammation. Repeated exposure can contribute to chronic sensitivity in some individuals. Maintaining appropriate water temperature is a simple yet scientifically important step in protecting the skin barrier. Small changes in routine can significantly reduce cumulative damage over time. Skipping moisturizer after cleansing is a significant mistake, particularly among individuals with oily or acne-prone skin. There is a common misconception that moisturizers increase oiliness, but dermatological evidence does not support this claim. After cleansing, the skin temporarily loses surface lipids that are essential for barrier protection. Without replacement, the skin compensates by increasing sebum production. This can lead to an imbalance where the skin becomes both dehydrated and oily simultaneously. Moisturizers are designed to restore hydration and reinforce the lipid barrier. They contain humectants, emollients, and occlusive agents that work together to reduce water loss and improve barrier function. Clinical studies show that consistent moisturizer use improves skin hydration and reduces irritation in both dry and oily skin types. In acne-prone individuals, proper moisturization can actually reduce breakouts by stabilizing the skin environment. Neglecting moisturization can prolong barrier recovery after cleansing. Over time, this leads to increased sensitivity, inflammation, and reduced tolerance to active ingredients. Dermatologists emphasize that moisturizer is not optional. it is a fundamental component of skincare. Even lightweight formulations can provide significant benefits without causing pore blockage when appropriately selected. Exfoliation is intended to remove dead skin cells and promote skin renewal, but excessive exfoliation can lead to significant damage. The stratum corneum is composed of tightly connected cells, and overexfoliation disrupts this structure. Physical scrubs and chemical exfoliants, when overused, can cause microdamage to the skin surface. This results in inflammation, increased sensitivity, and impaired barrier function. Clinical dermatology literature shows that overexfoliation can mimic symptoms of dermatitis, including redness, burning, and flaking. In severe cases, it can lead to chronic irritation that requires medical intervention. The skin requires time to regenerate naturally. Overstimulation of this process disrupts its biological rhythm and weakens structural integrity. Safe exfoliation frequency depends on skin type, but generally ranges from 1 to 3 times per week. Exceeding this frequency increases risk of damage without additional benefit. Maintaining moderation is essential for preserving skin health and preventing long-term complications.